So the pandemic really accelerated this in 2019 and 2020, but online delivery of medical services, sometimes called telehealth or telemedicine, has really taken off in the last couple of years. And what it did is it accelerated the acceptance of this type of conversation. And prior to 2019, many people would have been hesitant to get, healthcare information or, consultation without going in person to see a medical service provider, whether it's a doctor or PA or somebody else. People wanted to go in person because they felt like they had to be there in front of them for them to diagnose their problem. But in fact, more than half of the medical facility visits that are done don't require actual observation of symptoms. It doesn't require biopsies or lab tests or anything else. It just requires a conversation about symptoms, what you're going through. And telehealth or telemedicine is a great way to do this because the person does not have to physically leave their house. The travel time each way, even if you only have a half an hour ride to your doctor's office, that eliminates 1 hour of travel time. The other thing that it does is it eliminates that waiting room time, because when you get there, it's not like you walk right into the doctor's office. Sometimes you have to wait 30, 45 minutes because of the backlog of other patients. It eliminates that time. It also eliminates the possible health risk of being around other people that are sick. When you go to a doctor or a hospital, by definition, the people that are going there, other than regular checkups, are going there because they have some type of medical event. Now, some of those are physical injuries. You have a cut, sprained ankle, broken bone, whatever. But some of them are contagious type afflictions. And you don't want a lot of those people going to the doctor's office, or if they are, you don't want them going around people that don't have to go there. Maybe they need to discuss something, some other symptom. Maybe it's a problem sleeping or some other dietary issue. The more you can keep people away from that contagious environment, the better. So telehealth has stepped in to really fast forward that improvement. And this article in Barron's, very high profile business publication, gets into that. Now, we've all heard this before, but there's some interesting takes about the telehealth or telemedicine phenomenon that are relatively new. First of all, telehealth is more than simply a way to avoid contagion. It's a way for patients to bolster their existing health routines. Nearly 3/4 of telehealth users state they would use telehealth for prescription refills, discuss test results, and they believe that the professionalism of the provider is comparable to an in-person visit, right? So the quality of care is perceived to be the same, if not better, remotely. And for the providers, what they're seeing is it improves access, efficiency, reduce costs, and enable healthcare systems to do more good for more people. Like, you can reach more people, because if a doctor is talking to one person, on site, they have to have a 5 or 10 or 15-minute buffer between that person and the next person in case it runs over, or they have to wash their hands or do something different. Online telehealth can kind of crank one through right after another and have very little buffer time in between. And here's the other part. This is intuitive and it's obvious, but no-show rates for in-office appointments are 36%. A third of the people don't show up for their doctor's appointment, compared to 7% for telehealth, because you don't have to get in the car, you're not going to get a flat tire, you're not going to run late because there was traffic. It's a lot more likely you're actually going to make your appointment. Certainly, there are some types of visits that you need to go in person. If somebody needs to do like a palpitation or some type of physical inspection of symptoms, obviously that needs to be done in person. But many follow-up visits, consultation visits can be done in advance, and even prescriptions can be done through virtual consultation. And that makes it a lot easier for people to get healthcare, and it removes that volume from the system to free it up for other people that need more urgent in-person consultation.